It is well established that special education enrollment has increased markedly in recent years. The population of special education students served has grown at nearly twice the rate of the general education population. Moreover, special education students account for nearly 13% of the total education population. With more students comes more parents, and with more parents comes more questions in this sometimes confusing arena. But today, our agenda is to clarify and simplify, to replace those questions with answers, and we would like to do this by introducing Professor Knowit.
Thank you for joining us in this discussion about special education. Momentarily, we'll be joined by the host of the Ask the OT show, Dr. Frederick B. Covington.
Hello, my name is Dr. Frederick B. Covington, and I'm an occupational therapist. At the request of several parents that watch Ask the OT, today we'll be discussing common terms in special education. One of my most rewarding jobs has been working within special education, assuring that a student receives the appropriate accommodations that he or she needs to learn and be more productive. It's of the utmost importance and imperative that parents of students with special needs understand special education. This not only benefits their child's progress, but makes the parent the best possible advocate for their child. Now, I can see that there are a lot of questions, so let's begin with some questions from the audience.
What is IDEA?
IDEA stands for the Individuals with Disabilities Education Act. Now, the Individuals with Disabilities Education Act, or IDEA, is a United States federal law that governs how states and public agencies provide early intervention, special education, and related services to children with disabilities. It typically addresses the educational needs of children with disabilities from age 3 to age 21. IDEA defines a child with a disability as a child with an intellectual disability, hearing impairments, speech or language impairments, visual impairments, serious emotional disturbance, orthopedic impairments, autism, traumatic brain injury, other health impairments, or specific learning disabilities, and who because of the condition needs special education and related services.
Could you talk about IEPs?
Good question. The term Individualized Education Program, or IEP, refers to a written statement for a child with a disability that is developed, reviewed, and revised in accordance with federal law. The IEP guides the special education student's learning. It describes the amount of time that the child will spend receiving special education services, in related services the child will receive, and academic and behavioral expectations. Now, the IEP team meets at least once a year to talk about the child's progress and make any needed changes to the plan. Now, who is this IEP team? The IEP team is responsible for identifying and evaluating children with disabilities, developing, reviewing, or revising an IEP for a child with a disability. The IEP team may include, but is not limited to, the parent of the child, a general education teacher, a special education teacher, a representative of the local education authority, or a LEA, an individual who can interpret assessment results and the related instructional implications. It can include the related service personnel, such as the OT, PT, and speech persons, and, if appropriate, the child, him or herself.
I've heard of FAPE. What is it exactly?
Another good question. FAPE, or FAPE, is the acronym for a free and appropriate public education. This is the one most misunderstood concept of IDEA, and it is often the cause of the greatest conflict between parents and schools. Now, FAPE mandates that school districts provide access to general education and specialized educational services. It also requires that children with disabilities receive support free of charge, as is provided to non-disabled students. It also provides access to general education services for children with disabilities by encouraging that support and related services be provided to children in their general education setting as much as possible. This would be deemed as inclusion.
Are there different school settings? And what is an LRE?
LRE stands for Least Restrictive Environment, and means that a student who has a disability should have the opportunity to be educated with non-disabled peers to the greatest extent appropriate. They should have access to the general education curriculum or any other program that non-disabled peers would be able to access. The student should be provided with supplementary aids and services necessary to achieve educational goals if placed in a setting with non-disabled peers. Should the nature of the severity of his or her disability prevent the student from achieving these goals in a regular education setting, then the student would be placed in a more restrictive environment, such as a special education school, classroom within the current school, or even a hospital program. Now, generally, the less opportunity a student has to interact and learn with non-disabled peers, the more the placement is considered to be restricted. To determine what an appropriate setting is for the student, a team will review the student's strengths, weaknesses, and needs, and consider the educational benefits from placement in any particular educational setting. When determining the best environment for a child, often the terms public and non-public schools arise and come into play. A non-public school is an educational program that is run by a private person or a group instead of the government body. In terms of special education, a non-public school may be considered as the appropriate location to serve a student when a public school is unable to serve that student's needs.
Do FBAs have anything to do with BIPs?
Another very, very good question. Now, a functional behavior assessment is generally considered to be a problem-solving process for addressing student problem behavior. It relies on a variety of techniques and strategies to identify the purposes of specific behavior and to help IEP teams select interventions to directly address the problem behavior. A functional behavioral assessment looks beyond the behavior itself. The focus when conducting a functional behavior assessment is on identifying significant pupil-specific social, affective, cognitive, and/or environmental factors associated with the occurrence or non-occurrence of specific behaviors. Now, the FBA leads to the development of a behavior intervention plan known as a BIP. And this is a plan to teach acceptable alternative behavior. A BIP can be thought of as a plan to support the student in order to help him or her change behavior. Effective support plans consist of multiple interventions or support strategies and are not punishment. Positive behavior intervention plans increase the acquisition and use of new alternative skills, decrease the problem behavior, and facilitate general improvements in the quality of life of the individual, his or her family, and members of the support team as well.
I've heard mention of an IEE. What is it?
What is an IEE? That's an independent educational evaluation. Now, federal law defines an IEE broadly as an evaluation conducted by a qualified examiner who is not employed by the public agency responsible for the education of the child in question. According to IDEA, parents have the right to an IEE administered at public expense when a parent disputes the result of the school's evaluation. Thus, an IEE is not limited to evaluating only a child's academic or cognitive skills, but may include the evaluation of any skills related to the child's educational needs. Evaluations of neurological function, adaptive physical education, sensory needs, even music therapy are but a few examples of the types of IEEs covered under the IDEA. Parents may obtain an IEE for virtually any purpose if it impacts the child's education. A central goal of an IEE is to strengthen the role of parents in the educational decision-making process. and IEE provides parents added authority at the IEP meeting.
What is prior notice of placement or prior written notice?
Now that would be prior notice of placement or prior written notice. Now, according to IDEA, parents must be notified in their native language before a school district makes or denies any changes to a child's IEP. This includes before a child is evaluated, moved to or out of non-public placement, and before changes in services are made. The purpose of this notice is to give parents an opportunity to respond to the proposed changes before they occur.
What are related services?
RSA. That would be related services. Now, related services means transportation and such developmental, corrective, and other supportive services as are required to assist a child with a disability to benefit from special education, and includes speech-language pathology and audiology services. It includes interpreting services, psychological services, both physical and occupational therapy, recreation, including therapeutic recreation, early identification and assessment of disabilities in children, counseling services, including rehabilitation counseling, orientation and mobility services, and medical services for diagnostic or evaluation purposes. Now, related services also include school health services and school nurse services, social work services in schools, and parent counseling and training. Now, as always, thank you for joining me, and I hope this has been helpful in providing some enlightenment and guidance in the world of special education. Now, please feel free to contact us via social media or at askdrcovington@gmail.com. As always, take care, and we'll be seeing you next time.